Traces. When we are inspiring, when we inflate the lung, okay, this is the compliance curve. What is compliance? Delta V by delta P. So this is a compliance curve. But for inflation, compliance curve is different. For deflation, compliance curve is different. Okay, and this difference in the compliance curve during inflation and deflation is called as hysteresis. So hysteresis is the difference in the compliance curve during inflation. When lungs are inflated, they are behaving differently. When lungs are deflated, they behave differently. It is called as hysteresis. And what is the cause? Next MCQ, Viva question. What is the cause? Cause is concentration of surfactant is different during expiration and inspiration, hence difference in volume at the same pressure. So this is the reason of hysteresis. Now again, this is about the compliance curve. Delta V, whenever delta V by delta P is there, it is always compliance. So this is normal, and compliance will increase in emphysema because it is obstructive lung disease. So whenever volume is more, compliance will be more. In fibrosis of parenchyma, it can be asbestosis, whatever, they all are restrictive lung disease. You can see that compliance is less. So compliance increases in OLD, obstructive lung disease, decreases in RLD, restrictive lung disease.